So, guys, welcome back to our podcast. And like we said, without further ado, we're kicking things off today. And what are we kicking things off with, Namati?
Well, this is the special episode we promised you all about.
Let's put everyone out their misery and suspense. We're talking today about coronavirus, as many of you may already have guessed. Sorry to ruin the suspenseful moment, but I think it was quite obvious. We're all locked down. We're all stuck at home. The world is pretty much on shutdown right now because of this global pandemic that's going around, for those of you who are unaware. But it opens up a lot of questions that we want answering. For example, I'm trying to figure out how long this is all going to last for. That's a big thing on my mind. Am I going to have to keep going to uni, or do I get to stop and, take summer off? What's going to be the fallout of all of this? Like, when it all ends, where are we going to be left? What about you, Mohammed? Is there any things that you're particularly interested in finding out from this podcast?
Many things, and by the end you'll figure we haven't left. It gets right. I'm just gonna put this out there. If you're thinking of clicking off, don't. If you think it's the end of the world, don't think that. It's getting way worse. Like that's we're just putting that out there.
Yeah.
You'll hear things in the upcoming interview that you'll be surprised. I promise you. And the reason we're telling you this because me and Ashad, we did research. Ashad is medicine student. We still were shocked by.
Honestly, some of the things that you're going to hear in this interview will make you afraid of the world and everything to do with it. But you should still tune in and listen because it's important information. A lot of things that I learned, I didn't even make for example, the connection between viruses and.
Don't want to give spoilers away. Just
yeah. Well, we'll see. You'll see.
Yeah.
There's many topics.
Give them a hint. Cut yourself mid sentence.
Yeah, I'll say bioterrorism. What is the link there? How could coronavirus help save the United Kingdom? These are things that you might find out the answers to.
Yeah. It could bioterrorism, and corona.
Bioterrorism is bad, very bad.
Yeah.
Also, some of you may have heard of the book. It was a book written in 1981. The Eye of Darkness, I think it's called. And there's a lot of conspiracy theories floating around. Like, did it predict coronavirus? That's what I was wondering. And
we asked that from our guest. All right, let's get into it. We haven't even introduced our guest. We've been just talking about ourselves. Okay. So we're really glad to have managed to bring on Professor David Hammer.
Mm-hmm.
I have his biography in front of me, which I'm going to read for you. But he's basically the top guy. The top guy for if you have any. So basically, if you want to find him, easiest thing: Google infectious disease. Go to books. Third book. He's the editor in chief. Very easy.
Davidson.
It was written in 2008. The book, and it basically predicted that corona would come from animals.
So he's on a big mission right now, saving the world.
Yes.
And you can see why when you hear from him. He's a very, very talented man in his respective field. He knows a lot about coronavirus and he's taught us a lot of things as well. And he's got a lot of good jokes that, hopefully you'll be able to hear.
Hopefully you'll appreciate, guys.
Another thing that I want to find out about coronavirus is why is it that it originated from China? And that's something that the answer that he gave was quite shocking and something I wasn't expecting. And also, yeah, go on.
Go for it. Then I'll read the biography. Then we'll jump right into the. We were building too much anticipation, man.
Yeah, I'll tell you what. What we should do now then is just introduce Professor Davidson Hammer, and Matt, if you want to just share with everyone his credentials and his many areas of expertise before we then move on to look at the interview.
Yeah, well, basically, he has a very long biography. Like he's done so many things that, for the purposes of this podcast, this is literally 1/3 of the things he's done. But that's as and we've managed to cut it down so we can fit it in the podcast of his achievements. But basically, Davidson Hammer is a professor of global health and medicine at Boston University Boston, Massachusetts. What do you have to tell us about Boston, Ashad?
Fun fact about Boston, Massachusetts. It's the same state as The Conjuring took place, the book that we all read in English literature GCSE. I think that was in Halem, Massachusetts. The one about witches and I forgot the rest of it, to be honest. Hopefully my English teacher isn't listening. Continue.
Okay, so yeah, he's a professor of global health and medicine at Boston University School of Public Health and School of Medicine. Dr. Hammer, a board-certified specialist in infectious diseases with a particular interest in tropical infectious diseases, has extensive field experience in neonatal and child survival research, including studies of micronutrient interventions, maternal and neonatal health, malaria, pneumonia, and diarrheal diseases. And yeah, there are some of the other things I wanted to tell you guys about that are not on here. Mm-hmm. So he's done countless studies, and he's well, as we'll find out in the interview, he's currently involved with many studies regarding. He's like in the frontiers of studying corona right now. He's like the one creating experiments.
It's a miracle he had time to talk to us.
Yeah, it is a miracle. I'm really grateful, honestly. And he's had some big news media interviewing him,
like ourselves.
Like yeah, like ourselves, and likes of BuzzFeed and Business Insider. You know, same thing really.
Yeah, we're all big deals. We're all big deals.
But yeah, so please give us feedback. Tell us what you thought of the interview. We hope you like it, and yeah, we'll have more interviews coming up. Follow us. So we're Little Brains Big Topic. Big Topics at gmail.com is the email. You can find us on Facebook, Instagram,
YouTube. That's the other one. Facebook, Instagram, and YouTube. And
we'll make it Twitter soon. Don't worry, guys. We'll make it soon.
We will. Without further ado, though, here's the interview.
Ready.
Fantastic. So yeah, thanks again, Professor Hammer, for joining us today and talking to us. So just to begin with, I just kind of wanted to ask what kind of things you're involved with at the moment with regards to COVID-19.
Okay, a number of different things. So I guess I'll start with the hospital where I work, but I'll go beyond that in a minute. So I work, I'm actually in the Department of Global Health at the School of Public Health at Boston University, but I also am a member of the section of infectious diseases for the Boston Medical Center. And that there's a team that we formed there that basically is a COVID-19 response team, and it's extremely busy. We have daily meetings to review everything from, inpatient issues, outpatient issues, testing, sick employees, infection control issues, strategies for personal protective equipment, treatment trials, and treatment strategies for sicker patients. And then actually the homeless. So Boston Medical Center is in an area where there are a lot of homeless people, and we provide a lot of their medical care. And we've been very concerned that this disease, this virus, would really rage through the homeless community. And so a lot of extra work's been done, including even opening an old hospital to make rooms for homeless people that are sick and to be able to put them in isolation. So I'm deeply involved in a lot of ways, but I'm also been developing some studies that will be done. A natural history study I'm helping with a little bit, a treatment protocol for mild to moderate disease. I've been helping a little bit with trying to define or at least help us get participation in some clinical trials to look at more severe disease, anti-cytokine therapies. So really involved in a lot of different ways, but then also helping a little bit at a higher level for the university, and then also one of the radio stations, WBUR, and developing their strategy to keep their employees healthy. or for this university itself, is actually like, when will school reopen, and what do we do when school reopens? Some tough decisions about that. Separately, I run a surveillance network called GeoSentinel. That's a global surveillance network that looks at, well, normally it looks at returning travelers, immigrants, and refugees that are seen at any one of the 68 sites in 28 countries that are part of the network. And then we look at what disease, what infection they have, where they acquired it, and try and use this to assess patterns of infectious disease transmission in different parts of the world, but also to identify new outbreaks. And so all of our emphasis has been shifted to treatment and prevention trials for COVID-19. So I've been very busy actually spending time with one of those protocols today, also reviewing a healthcare worker prophylaxis study that one colleague has designed.
Okay, thank you for that. That sounds very, very busy, but also very interesting. So thank you for sharing. I think we had a few general questions with regard to infectious disease before we talk more specifically about COVID. So I think Namati has those for you.
Yes. So my first question. So in preparation for this, I read I read your book, Public Health and Infectious Diseases, the introduction to it. And I found some very interesting facts that I didn't know about. So in the book it said that at the beginning of the 20th century, infectious diseases were the leading cause of death worldwide. So my question is, was that the case in the centuries before that as well? And if so, do we have any idea of like how many?
I'm still here.
Oh, fantastic! I think Namati's having some internet problems.
Oh, is it?
So I think.
Is it from my? Or was it my? Oh, internet connection is unstable.
Yeah, you're back. Okay. You're back.
Perfect.
Did you pay your bill? Yeah. So to answer your question, so was the question, was this true in centuries before this last century?
Yes.
Yeah, I mean, this has been true for millennia. I mean, I think that until the last 100 plus years, infectious diseases, whether it be pneumonia, malaria, a whole host of other diseases, influenza and so forth, have been responsible for a substantial proportion of deaths of humans. But as we developed better water sanitation and hygiene, the development of antibiotics, vaccines, we developed a lot of tools that have allowed us to better address infectious diseases. So in the last, especially the last couple of decades, but I would say almost the last 80 to 100 years, they've dropped down so that, I think pneumonia and respiratory disease are still probably in the top 5 for causes of death. But things like, heart disease, chronic lung disease, at least those, and cancer are high on the list now for causes of mortality. This is going to change, actually. There are data that came out from the CDC just a few days ago in the US suggesting that COVID-19 has moved up to something like the 3rd most common cause of death in the United States right now.
Really?
Behind just heart disease and cancer.
Wow, that's a lot of people. What 3rd cause of death in the US is corona right now?
Corona right now,
wow.
Yes.
And so my questions I had a follow-up on this one, that do we have any idea of the scale of like how many more people died because of infectious diseases as opposed to human conflict? Do you have any, throughout historically speaking, not recent memory, but do we have any idea of the scales? Or
I mean, I'm not sure anybody's tried to summarize the scale, but I mean, I think over time, if you include all, say a 500-year period, I would bet that infectious diseases accounted for greater mortality than conflict.
Wow.
The thing is that even in the context of conflict, when you have got a bunch of soldiers that are wounded, and until we did better with hygiene and cleanliness in hospitals, soldiers would have a wound that now they would survive, but then they'd get septic and die from it because of really poor practices. I mean, this is where people like Semmelweis, who sort of advocated, better hand hygiene, and then Florence Nightingale and others who advocated for much cleaner approaches in hospitals because they recognize of all the sort of risk of hospital-acquired infections. But that said, I think that overall the risk, because war, there'll be a period of war and then there's a long period of peace. But during those periods of peace, there would be a lot of continued fatality due to infectious diseases that were poorly controlled until really, the 20th century.
So if you want to save maximum lives, become a doctor or go to medicine as opposed to going to politics. That way you can save more lives.
If you're a politician and you make good decisions, you can also save a lot of lives. Strengthen the public health system, for example.
Yeah. In here, we hope it can keep it up though, because apparently there are like two curves. There are two different. There's one with a wide distribution and there is a short distribution one. Do you have any idea which one, if we're gonna hit the short one or not?
I think it depends on the location.
Right.
My hope is that countries the UK took a little bit longer to come to some of these social distancing measures, but I think you're doing it now. And then the US, it's been, some states have taken more time to get to the point of making sort of universal recommendations. And in any case, I think we're going to see different impacts on that curve in different places, whether it's at the state level or even the city level in some places. But I think that ultimately there are a lot of effective measures that have been implemented that will, flatten the curve and extend things over time, but overall reduce the total number of cases down to a more manageable level. But it's going to spread it out over time, and we're going to have to keep our guard up.
Right. So another question I had was was the book written in 2008? The public health and infectious diseases was it
about then?
Right.
Yes.
So in the book it says approximately 70% of recently emerged infectious diseases have animal reservoirs. So my question was, you predicted corona. Back then. Nobody listened. So how do animal diseases, animal infectious disease, how do they make that jump to humans? That's
a good question. So I think that those figures are still roughly right, that a substantial proportion of new diseases or emerging infectious diseases come from animal sources, from zoonotic sources. And there are different ways that they jump. I think it depends a little bit on the kind of disease. For respiratory viruses, they can be from direct transmission from an animal. So there are periodic outbreaks of new strains of influenza that are recombinant strains between human, pig, and sometimes other animals. And those recombination events lead to a new strain. They could start out with pigs and then jump to humans because of close contact. In fact, there are outbreaks of swine influenza at fairs around the United States every summer, now that we have better ways to identify them. So that's one mechanism. China, at least SARS and MERS, those, it's really now two SARS coronaviruses. Those really emerged from close contact with animals. We believe, at least, the original SARS was palm civets in what are called wet markets, so markets that sell live animals in China. And I think that those kinds of places, whether it's a live market in Asia, and China has many of them, or at least I think Chinese are trying to shut them down now. But they historically have eaten many unusual things. But also, I would say, if you go to sub-Saharan Africa, there's bushmeat, trade in bushmeat, and that is a very broad term for almost any wild game. But that can include non-human primates, monkeys and so forth. and they can carry a bunch of viruses that are because they're so close genetically to humans, they can easily jump to humans. And then there's other modes. Ebola, for example, probably goes from bats to either directly to humans or bats to a non-human primate, and then we're exposed to an infected non-human primate, and they can die, they can get sick and die from that too, but that's another mode of transmission. So it's really, I think, a variety of things. One is closer contact with animal sources that are infected, whether it be through markets, through culinary habits, eating habits, or through deforestation and other sort of agricultural activities that lead to sort of an encroachment of humans on places where there may be novel viruses.
Mm-hmm. And this leads me to my next question. So you got connected fairly nicely. So was this pandemic destined to come from China, since they have such a huge population, or was China uniquely susceptible because of, for example, their eating practices?
That's a tough question. I mean, I think that China is, has a higher risk, but there are other countries that have unusual eating practices too, where something could arise. Vietnam, for example, or a number of countries in Southeast Asia. And then I'd say, the risk for something emerging in Africa is also pretty substantial, through similar practices. And in fact, obviously Ebola is a very good example of that. But then Latin America, I think there's a potential risk for novel viral pathogens emerging from the rainforest, from the Amazon basin. So there's a number of different places where there's a risk. I think Chinese are at somewhat higher risk because of some of their eating habits. If an outbreak started, if you start having a lot of, if you're like Wuhan, it was a transportation hub. And so there are lots of people flying out from there. And that really facilitated the spread of the disease after its emergence.
I was just going to ask, related to that then, with regards to these exotic markets, do you feel like it's within reason that they will be shut down? Or do you think that shutting them down will just kind of lead to the emergence of black markets with less regulation?
I don't know how much regulation there was in the current markets, but I mean, the Chinese government has said that they are going to shut these down, or have tried to shut them down. I am quite worried that, that will last only for a little while, and that they'll let them open up again, or B, that as you said, that they will basically lead to black market trade and places that are even scarier in terms of their risk of transmission of disease.
Sure. Also, I wanted to ask, sort of related, obviously since China's kind of onset of coronavirus, it seems outwardly that they've done quite well to regulate or control the spread of the virus. I wanted to ask, what is it that allows for some countries to deal with the virus so much better? And why is it that some countries are affected so much worse from the same virus? Assuming that people have the same kind of knowledge and resources to deal with it, or is that a wrong assumption?
Well, I mean, it's theoretically correct, but in practice may not. Well, anyways, I'll just comment. So they're first of all, the Chinese appear to have gotten this outbreak under very good control. They use some very aggressive approaches in terms of testing, identification of infected people, and then hospitalizing everybody who's infected. In contrast, in the United States and a lot of other places, that's not been done. First of all, there's not been enough testing, but second, there's not enough hospital capacity to put everybody in the hospital.
Oh.
And so people are, if they have milder disease, they're told to stay at home and to self-isolate. That may be a less effective strategy. Having ample number of tests is really important, and that's been a major problem in a lot of places. I think Germany's done well on the testing front, but a lot of other countries haven't. China has also, now that they've got things under better control, gone to intensive contact tracing. And the countries that have been really successful in controlling this are Singapore, Taiwan, China, although honestly, I would be a little cautious with the data coming out from China. I think they're trying to paint too good a picture right now.
Sure.
I'm not sure. I mean, I think they've been relatively open, but now it's starting to look almost too good.
Right.
And so I'm a little skeptical. But that said, but Singapore and Taiwan have done fabulous jobs with very intensive measures that include a lot of testing, identification of sick people, contact tracing for those they've been exposed to. In Singapore, using apps that basically people have on their phone that can record when they've been within a certain distance of anybody else, using Bluetooth communication between phones. I mean, there's some human rights issues in terms of privacy, but we may not be able to do that in the UK or the United States, for example. But I think some of those kinds of strategies have helped these countries control things. South Korea is another example where they've done they're doing a lot of mapping of where cases are. They're doing contact tracing. They're also, when they identify people as sick, they separate them from, they take them out of their home and have them go to a hospital. They have hospitals for milder cases, and then they have the big hospitals for older people and much sicker cases. And I think separating out the infected patients is really important, along with effective contact tracing and lots of testing.
Yeah, the UK's not been so good on the testing front, as far as I understand. We've been quite conservative with the amount of testing we're doing, which is, I suppose, maybe not for the best.
Yeah, we have the same problem here.
Yeah.
Would you like to ask question 7, Ashad, because of the...
Yeah. So the next question we had for you, Doctor, was we wanted to know kind of why coronavirus has caused so much more global disruption than past pandemics like SARS, swine flu, Ebola. What is it about this virus that's led to it being so disruptive on a global scale?
I think part of it is it's just very contagious. I mean, Ebola is an interesting example because Ebola is also very, very contagious, but it's usually been limited to just like one location, and there's been an intensive emergency response to it and a lot of efforts to containment, intensive contact tracing, and isolation of infected patients. And so, the worst outbreak was the one in Liberia, Sierra Leone, and Guinea a few years ago. That one, took quite a bit of effort to contain it. And the more recent one in the DRC was challenging because of political strife. Well, really, I would say because of almost civil war and because of the location. This, I think, part of it relates to this virus. There's good evidence now that it can be transmitted by completely asymptomatic people, or it can be shed by people in a pre-symptomatic phase, before 2 or 3 days before they develop symptoms, and that it makes it harder to do screening based on symptoms to identify infected people. For one, you really need to sort of identify people that have had contact with someone who's infected, and then have them do quarantine, and then isolate them if you can prove they're infected. And I think the lack of testing, and just the other thing is there's a thing called the basic reproductive number, or R naught, which is basically it's an estimate of the number of infections that a single person will cause in people that they have contact with. So with influenza, it's usually around 1.4, 1.5. So that means one person might infect, or say 2 people might infect 3. But with this coronavirus, it's 2 to 3. So every person who's infected spreads it to 2 or 3 more people on average.
Is that with the quarantine measures that are in place, or?
Well, that's in the absence of any quarantine measures. Quarantine measures will help reduce that, yes, and if they're implemented effectively. So I think it's the fact that it can be spread, and the other thing we've learned about a lot, mostly in the last 2 weeks, is that it can be spread by aerosol. So we know that it's respiratory droplet, which is like if you cough or sneeze, you've got these droplets in the air, and then they sort of fall to the ground after, especially if you're more than 2 meters away. But it turns out that there's smaller droplets that stay in an aerosol, and unless you have really good circulation, like open windows or you're outdoors, or in a building with very good turnover of the air, this aerosol can hang around for a period of time, and that can be infectious. In fact, there's some really elegant studies showing that you can even still identify the virus in those aerosols. And so I think that our better understanding of the biology and modes of transmission have been very important, but also that this is a very infectious virus and it's spread very quickly.
Yeah.
Would you like to ask question 9, Ashad? Because I think 8 we're gonna skip over.
Yeah, it's kind of related anyway.
Yeah.
Our next question for you was, obviously it's caused a lot of global chaos and concern, as we've seen. What do you think is going to be the fallout from the virus? Where are we going to end up, and when? If you have any idea of like a time scale as well.
Right. I mean, I think that ultimately we are going to be looking at probably several million deaths worldwide from the virus when we start having massive epidemics in India, Pakistan, Bangladesh, in densely populated countries in South Asia, and potentially in sub-Saharan Africa, a place like Nigeria, if it's not controlled well. And I think that it's very hard to control this. So I'm quite worried about especially low and middle income countries and what's going to happen there. I think that we're going to see, a peak and then a gradual fading out of infections in higher income countries like Western Europe, the UK, the US, and then it actually may get down to such a low level that we can use much more intensive public health control measures to sort of weed out the final cases. But my worry is that when we get back to the next respiratory season, like late fall, winter, we're going to have a resurgence again. And so we're gonna have to really keep our guard up. I think hand hygiene, respiratory hygiene, a lot of things that we are doing to control this epidemic are going to become habits and things that we have to do, on a regular basis. So I think there are going to be a lot of changes to behaviors that are going to be, sort of both inherited from this, but also necessary for the future.
Yeah.
Wow.
Thank you.
I had no idea about was it 5 to 6 million?
I'm estimating at least 1 million, but It could be more.
Right. So,
just to give you an idea, I mean, like the current estimate for the U.S. is around 100,000 deaths.
Wow, and that's like the U.S.
And so, and then you're gonna have the UK. I mean, you might lose your leader.
Oh, but yeah.
I don't know how sick.
It will be good news for some.
Right. So does that mean the end of Brexit?
Imagine. Corona may have just saved UK. Keep it down. Okay.
You mentioned about the mutations come wintertime, or potential for. Yeah.
So my we're on 10, aren't we?
Mm-hmm.
So my next question was: are there more dangerous infectious diseases awaiting us in the future? So, yeah, that's the question.
I would say yes.
Right.
And we don't know. I mean, we can sort of speculate where they might come from. I mean, I think there's probably two really major categories, and those that are sort of respiratory viral infections, and then vector-borne disease. So things carried by insects, whether it's mosquitoes or other ticks or mites or whatever. And that I think we partly because of climate change, the risk of vector-borne disease is going to continue to increase. And so the next Zika or another chikungunya. But there are a lot of other pathogens out there that could arise if the right context is there in terms of distribution of vector and then climatic conditions. I think respiratory viruses, whether it's another coronavirus, some really unique strain of influenza, or some other virus altogether, is definitely a possibility too.
Wow.
Mm.
So something to look forward to over the next few years.
Yeah, you were scaring us a lot today, Professor. Never been this scared for a while. So yeah, so my next question would be, so we're going back to your book. So there was a very interesting quote that I took where it said, the political will to combat diseases may be lacking, and conversely, the intent to cause harm through bioterrorism is present. So could you explain to us about how the political will is lacking, and what are bioterrorism, like, should we be worried about bioterrorism?
So those are two different questions. So I think the political will. I mean, the political leaders need to. I think this is going to be a tough lesson learned for leaders in many parts of the world. And I'll sort of start with the U.S. as an example, but we've made a number of mistakes, and part of it is over time is defunding public health control measures and surveillance systems, and so that there are things that if they'd been stronger, and if more sort of preparedness plans had been in place, then we might have been able to act sooner and have less damage from this outbreak. I think this goes beyond just any one country, but also we need global leadership in the World Health Organization. And the problem is the World Health Organization's got a lot of smart people, but it doesn't have any teeth. It can put out guidelines, but it can't enforce them. And so we may need to rethink a strategy that allows it to have a little more, sort of power or to influence its member states. So I think there needs to be stronger political will, but also support for being ready for the next outbreak and being able to respond in a more agile and effective manner. In terms of bioterrorism, that's quite a different topic altogether. I think that the possibility with all the scientific literature and easy access to the internet in many parts of the world, it's quite feasible for somebody to cook up, to take some pathogen that can be potentially aerosolized, concentrate it, and figure out a way to effectively distribute it and cause widespread outbreaks. And so I think that's scary. And I wouldn't want to give any ideas, but it's like sort of reconstructing smallpox, for example. And figuring out a way to release that would be just disastrous, because that's a highly lethal virus. It's been eliminated or eradicated, although there's at least 2 freezers worldwide at CDC and in Russia that still have the virus, but there's concern that could exist in permafrost, for example, and or that somebody could reconstruct the genome and develop it almost in vitro. Anyways, so there's some pretty scary prospects for bioterrorism, but you guys are going to be having nightmares pretty soon, so I better stop.
I've never been this frightened in my life. Let me just put it out there. I was stressed throughout the interview. Now I'm stressed throughout everything.
There's did you hear? There's the book, The Eyes of Darkness. It's a novel from 1981. And there's a lot of conspiracy theories floating around about how it may have predicted coronavirus, and it links it to bioterrorism. Do you think there's any substance to that, or is it a load of rubbish?
I've read a bunch of conspiracy theories about this coronavirus, and I pretty much all of them are pretty shaky in terms of the scientific underpinnings. Yeah. So I think this was a chance event, whether it came through an infected person that infected some of the animals there, or if it came through a bat directly, or if it came through some other intermediate host like a pangolin, which has very close SARS coronavirus that infects it. We don't know, but I don't think it was maliciously planted there.
Thank you. One final question for you then, Professor, if that's okay. We just wanted to ask quite generally then to finish up. Viruses have caused a lot of stir, obviously, recently. If you compare the different types of microorganisms, viruses, bacteria, I think you mentioned vector-borne diseases as well, is there a most dangerous or one that we should be most cautious of, or do they each carry their own kind of dangers?
Each carry their own kinds of dangers, but if we had if we had a widespread Ebola outbreak, for example, or Marburg virus, those are, highly lethal pathogens that can cause case fatality rates of 60% or more, or more than half of people infected die. That's pretty scary. Another one that's really, sort of worrisome would be avian influenza, so the bird flu. And the issue there is that there have been little outbreaks here and there where people have had a lot of exposure to infected poultry, but the virus hasn't been fit to move person to person. And that's what happened with this virus. It sort of jumped from some animal species or directly from bats to humans, and then it was already fit to be spread easily in the community. Fortunately, avian influenza has not made that adaptation, but if it were to mutate and become more adapted for person-to-person transmission, that could be very scary, because this is another virus that can cause very high death rates in infected people. So yeah, there's a number of different potentially worrisome options out there or possibilities.
I see. Thank you very much. I think that's a good note to finish on.
Bright. Is there any bright note to end on? Is there anything?
I think you should. It's good to end on an optimistic note. First of all, I think we're going to get this epidemic under control. We're going to learn a lot from it. We're going to be better. We're going to better develop systems and planning and forecasting to be able to deal with the next massive respiratory virus outbreak. We're going to learn a lot about how to rapidly scale up testing and how to do investigational treatment trials in the middle of a conflict, or an outbreak, I guess. And so there's going to be a lot of important lessons learned. The other thing is that our ability now to rapidly identify novel pathogens and to do whole genome sequencing of viruses and other organisms is amazing now. So much better now than it was 10 years ago. And that allows us to really look at evolution, but also to identify new pathogens and to learn about their biology in a way that will help us to better control them. So yeah, there's I think there will be some good lessons. And then the other one is just I think that the world is not going to be the same after this outbreak. That people are going to be there's going to be a lot more alcohol-based hand wash stations in different parts, on your way into the tube or wherever, and there's going to be a lot more attention to sort of interpersonal contact and how that can transmit disease that will change people's behavior, at least for the near term, if not long term.
People will be more hygienic.
Yeah, and I think that will help in a way and help reduce risk.
Okay. Thank you very much, Professor, for your time. We really appreciate in these busy times. Your job is very vital, and thanks for coming on. And I was wondering if we could have you back on after the pandemic is over to talk about your other works in general, globally, everything else.
No, I'd be happy to do that.
Perfect. Thank you very much. Have a good. Is it noon? Is it afternoon there now?
No, it's 5:30 now. So
have a great afternoon, and good luck saving the world.
Okay, good. Thanks. Nice to talk to you of you. Okay, take care. Good. Have a good evening.
Man, we've got a lot to think about. I'm scared. I'm very scared. I can't lie. How do you feel?
Yeah, as I told you, I'm like I've already had difficulties sleeping, so my eyes are going a bit red.
You got bags, man. Bags. The importance of sleep.
Yeah, let's say. Oh yeah, we're gonna. That will be one of our episodes. Importance of sleep.
So have that to look forward to as well.
Yeah, we'll bring in relevant experts. Don't worry.
Hopefully, Matt Walker.
Matt Walker.
Yeah, he wrote that book. He wrote that book about sleep. It's a very big book.
Right.
Why we sleep. I read that. So ever since then, my bags have been gone. My skin's been clear and beautiful.
Really?
So yeah, I recommend it. You got bags, bro.
Looks like I'm literally dying.
Yeah.
I'm not in a.
Nah, you're good.
No, I'm dying because of the viruses in my body.
To be the cause. Yo, I was shocked. You know when he said several million people will die.
Yeah. 5 to 6 million people will die worldwide, and it will be poor people. And it will be poor people like sub-Saharan Africa.
That's terrifying.
Oh, the poor. Yeah.
He didn't say it like it might happen. He was saying in Africa, in India, Pakistan, when it happens, and it's such an inevitability.
It's mad.
That is terrifying. But hopefully, you know, as a population, we're able to learn from it and move forward, like he was saying.
Yeah.
The other thing that really scared me was about December, and he said that when the cold months come around,
he said it could make a comeback.
So this could be a lifelong thing.
No.
This could be.
Yeah, the comeback is scary. Imagine like it's gone and then it just comes back and like it holds the economy again. Everything, bro.
We're gonna have to find. I feel like society as a whole is gonna need to figure out a way to work around. You know, I've never really in my lifetime taken viruses or viral infection seriously because we had swine flu and it passed. This is the first time, you know, I've had such a wake up call. Obviously, I wasn't around or old enough when SARS was going on to really appreciate anything that came from that.
But it wasn't anything like this.
Exactly, it wasn't anything on this scale either. No. So it's going to be a scary, scary time to be alive, but we'll adapt. Human beings are adaptable, man. We'll figure out a way to deal with it all.
Mad. Right. My hope was, my hope is, because generally, right, what's happening around the world is that people are, what is it? Is it like $18 trillion being spent each year on weapons? Something like that.
So much more is being spent on weapons than scientific.
So much more because that's why I asked my first question was regarding how many people were killed by diseases and how many were killed by human conflict. You know, we hate we don't like historical like tyrants, for example, Genghis Khan. Everyone hates but we don't have the same
towards viruses,
the same hatred towards pneumonia. But pneumonia killed literally way more people than Genghis Khan.
And maybe that's another good thing that will come from this outbreak, man. I mean, of the few good things there is, maybe one will be a greater prioritization towards scientific research and medical.
And humans realizing that we're all the same. We're the same species, and you cannot. Viruses don't know borders. They'll come and get you. They don't know class. They don't know borders. They'll come and get you. They'll come and get you. You better get your act together. Instead of trying to fight, getting weapons, trying to kill each other, maybe we should be all working together to tackle problems like global pandemics, like global warming.
It's like you're saying, media for the longest time has perpetuated this idea of human beings and different nationalities and different and people being different to each other, and that just breeds hate, like you're saying, man. We need to start seeing each other as the same, and that's the other thing that I found
nature forces us. So
yeah, exactly, and it has done here. I feel like one of the consequences of this virus is countries are kind of working together. The professor was talking about all the work he's doing in different countries, and it's like we're not seeing each other as different. I think they're talking about talks of a global ceasefire while this coronavirus business is going down. Maybe that is a positive that can come from this. We start working together as human beings. Like you're saying. That's what we need. And
I like what he said as well. He said, "Oh, there will be like more places like to make yourself hygiene. We'll care more about, and literally, if you care about hygiene, then you'll get fewer diseases even in the future. None related to you'll still like." That's good that we got into the habit of
going to public toilets and seeing people walk out without washing their hands. It happens way too often. So maybe this will change that, you know. And also people, they're walking out the toilet, they just grab the handle. Like, think about how many dirty hands have touched that handle. I
never grab the handle.
I wait until someone else walks through the door before I leave.
I put my foot in the middle, first best, when just as it's, because it's a bit weird if the guy has opened it, you just go. I let as the door goes to shut, I put my foot in between. Then I kick it open because I don't want to use my hand.
But the top of your shoe, bro, that that just gives me even more paranoia. When I get home and I'm unfastening my shoelaces, I'm like, wait, this has just touched that door.
No, but you will wash your hands. You know what I mean?
Yeah,
like,
this is
because
true.
usually when you take off your shoes, it's when you just got home. Little brains.
Yeah, it doesn't feel so little anymore. It feels like we've learned a lot.
Bro, I feel like I'm having brain meltdown right now. No.
Yeah. Crazy. Very interesting. Well, that was just episode number 1, guys. And hopefully you've stuck with us all this way and you've heard lots of interesting information about coronavirus. You've got more to look forward to in the upcoming weeks and months, as we're going to explore many different topics, some related to coronavirus. For example, isolation, being locked down. Often people are locked down on their own. It can cause a lot of problems in the mind, loneliness, isolation. And it would be really interesting to do talks with experts about that in general as well. And that's something we hope to do in the future. Is it not, Mohammed?
Definitely. And we had another one tangent to corona. It was developing drugs and vaccines, I think. We're going to have someone about that as well.
Yeah, this Professor Hammer he alluded to some of those ideas about treatment, but we do want to understand them in a lot more detail. Obviously, we didn't have a lot of time. Maybe it could even be him talking about them.
Well, yes, but we don't want to. Let's let him save the world. After that, then maybe he can do our podcast.
Yeah, I mean they're on a similar. Yeah, we put in groundwork. I think if we want some work experience as well, I'm sure he'd be more than happy to host us.
Imagine. Oh yeah, it's good. It's going to be good for you. I'm telling you, it will be good.
Yeah, that's good. That's good to hear.
Wait, I was going to mention this as well to you. I forgot. So another positive thing is that apparently, again, please feel free to fact check me and prove me wrong. But I think if corona continues for like 1 more month, the carbon levels in the atmosphere will go back to 1980s.
Surely not. Where did you get that fact from?
So maybe it was pollution. Not
really?
Pollution. Yeah.
Really? Wow. I did hear that the Earth's crust is moving.
Apparently, currently it's at 1990s now. We're at 1990s. It's going to go back to 1980s if it continues for another month.
All it took was 2 weeks of social isolation,
bro. No, well, it's been 2 weeks in the UK, but China is shut down the world.
Yeah.
What you were? Sorry, I interrupted you. I'm very sorry.
I was just going to say, are the hospitals that are treating coronavirus, are they not kind of releasing a lot of carbon dioxide and greenhouse gases because of all the the electricity resource intensivity that they're working with? Surely that would bring up the levels again. Well, I don't know.
I think one of the main source. We'll bring someone to talk about global warming as well. By the way, that's one of the future episodes.
Yeah, look forward to that, viewers, listeners.
But essentially, I think one of the main causes was were airplanes. So now, pretty much all commercial airplanes globally have shut down. So no plane is flying. So I think that was a huge contributor. A lot of factories have shut down. People aren't using cars anymore. They're not going out anymore. So that's
so true. Now think about it.
But so another positive, and apparently, there's some animals that were going extinct are going back to their habitats because humans have left there. So I
saw a video of some sheep playing in a park. So it's a good sign. Maybe
a chimp.
No, little sheep. Sheep were playing.
Sheep.
They were on a merry-go-round. So maybe when our kids go back to the parks after the lockdown's done, they're going to be greeted by loads of farm animals just having a good time. And
we're going to be eating them all. You know that.
One more final thing I want to say about a possible benefit of this lockdown is, one thing I've found, being at home, being with family, it's allowed you to reprioritize a lot of things, or it has for me anyway. Like, I get so caught up in life, being outside, being away, doing my career, university, whatever it may be. I forget, the simple things in life, spending time with my family, talking to friends, keeping those connections strong, and being at home And I feel like through being locked down, that's something that I've developed a lot. And I hope that I can maintain this close bond with my family, talking to people, communicating, seeing each other as the same, not different. I hope we can continue that after, lockdown gradually ends and we move away from coronavirus.
Wait, were you seeing other people as different before coronavirus?
No.
Did you just admit to something?
No, I never see anyone else as different. However, subconscious bias is a real thing. We have cognitive biases. It's a natural part of human life and the human brain. You take in so much information every day that sometimes your brain makes shortcuts and they can be detrimental. So you can see someone wearing broken clothing with tattoos and think, oh, they're different to me. They're trouble. I'm going to stay away from them. Is that a productive way of thinking? That's what we need to ask ourselves. And, maybe this lockdown has been the first step to acknowledging those cognitive biases we all have and working towards breaking them.
We got
in answer to your rather
we can bring again, cognitive bias is a real thing. We could bring and that's why basically that's what makes a lot of some scientific data, it makes them useless because the person conducting it wasn't able to remove their personal bias, so they ruined the result and made the experiment useless.
Really?
Yeah, that's a real thing. Like that's what especially in biology, so even psychology, they're finding it difficult to get rid of that cognitive, the researcher's bias basically. Because so for example, we haven't. So apparently, the studies done on meditation aren't really reliable because most of the researchers doing it, they were like pro meditation, like they wanted to find. So the person was like doing meditation already and was feeling good. So it's like, okay, let me design an experiment that shows meditation is good.
Yeah, man. So should we wrap things up then?
Yeah, let's wrap it up.
Tie it off in a neat little bow and score a 3-pointer. Shout out Kobe Bryant, may he rest in peace.
So wait, I'm hearing myself. What's happening?
I cannot hear you. Okay. I mean, I can't hear you.
Well, okay. Anyway, make sure to, if you like the episode, like, suggestions, email us at littlebrainsbigtopics@gmail.com. Or you can comment if it's on YouTube, like, share, subscribe, or follow us on Spotify. We're on Spotify, Instagram, Facebook, everything. Yeah. Other than Twitter. Everything. We're Little Brains Big Topics. Did I say big ideas by mistake?
Little Brains Big Topics.
Yeah,
you did.
I sometimes say big ideas. Just
we are becoming more comfortable with the name of our podcast, which is positive. Also, one thing I wanted to ask Namati, when we were saying goodbye to Professor Hammer, did you realize we said the exact same thing at the exact same time?
No. Only if we had the recording to check that.
If only. So rewind, guys, if you didn't catch that, and comment in the description. Comment down below what we said. Just to up the comment number and get us more clout.
Yeah, guys.
So that would be.
And as always,
thanks for watching.
Peace and love.